Hi everybody, my name is Jaime Soria. I'm ophthalmology retinologist, and right now we are with Serge Resnikoff. He's the Director of Eye Care in the International Council of Oftalmology, and he's going to explain a little about his trajectory. Hi, how is your trajectory until right now?
Well, thank you for asking the question. I'm very happy to be here. I actually started my professional career as a general surgeon and then trained as an ophthalmologist, and I was mainly dealing with anterior segment, was high volume cataract surgeon, and I worked for many years, 16 years in Africa in different places. And then I joined the World Health Organization, and so I turned my career more on the public health side. And after working again for more than 10 years for the World Health Organization in Geneva, I worked for a couple of years with the industry. I was the CEO of TEA, which is a pharmaceutical company in Europe. And now I'm a visiting professor at the University of New South Wales in Australia. I'm very much involved also in the International Council of Ophthalmology and working also with a number of different NGOs. That's where I am now. So
in your experience working in all different parts of the world and knowing all about this organization, what could be your recommendation for the resident programs in Latin America?
I think that what I would kind of recommend to any resident or young ophthalmologist is not to go too quickly into any subspecialty training, but to make sure that to have an experience that is sufficiently holistic. I think it's very important to keep in mind that we're dealing with patients, and the patients are people. A patient is not just one disease, a couple of diseases. It's a person with needs, with a family, with a life, with some expectations. And we sometimes, because we're dealing with a small organ, we're very, very focused on that organ. We see the patient through our slit lamp, or through the ophthalmoscope, or through the operating microscope, or through the OCT. And I remember in my time, sometimes I was recognizing the patients just by the iris or by the retina. But that's not the appropriate way of doing things. We're dealing with people who have needs. They come and they seek some assistance because they have pain, or there's some discomfort, or they cannot see. And it's very important to keep that in mind. I was telling in a number of cases that when I was doing surgery, for example, I was only interested to see that the cornea was clear and the pupil was round. And I didn't care about the visual acuity and the quality of life of the patient. And that's completely wrong. And I think this is very, very important, particularly at the beginning of the professional career,
yes,
to think about that.
Because even in the resident program that I have not so high volume of cataract series, there is a lot of things that I can learn in other diseases, in diabetic retinopathy, in glaucoma, error refractors, yes, and give to all his patients an integral help in other kind, like in a good attitude, and really try to help these people.
You're absolutely right. I mean, the word attitude, I think, is particularly critical. You know, it's all about knowledge and skill and attitude, and in many cases in residency program, there is a lot of focus on the knowledge and the skills, and not enough on the attitude. And what I've, for example, observed that in places like EMO, for example, there is a lot of training in terms of attitude and how to actually take care of the patients. We ophthalmologists are medical doctors. They are not technicians, and I think that's very important.
And talking a little more about the acknowledgement, which is the place that you can say that you can have the correct information, the correct guidelines, or the correct epidemiology data that everybody can use in his own place?
I think there are a couple of resources that it's worth mentioning. Regarding the epidemiological data, there is a group that is called the Vision Loss Expert Group that is maintaining a website, and these data are transformed into something that is called the IPB Atlas for vision, and this is accessible on on the internet, and you can find data by at the global level, at the regional level, and also at the national level. And that can be extremely helpful, particularly for people when they're preparing a presentation. You can immediately download things that will really make very good looking PowerPoint presentations in terms of epidemiology.
And understand the real problem in your local area, in your country. Are there numbers? How many blind people there is?
Exactly. You can find the number of people blind. You can find what are the main causes of blindness and visual impairment by level of visual impairment. And this is really something that could help to make nice presentations.
And in a clinical way, the guidelines, where they can find it?
There are many guidelines. We are not short of guidelines. What is sometimes missing is that some of these guidelines, they have been made for people working in very high resource settings. It's kind of for people, there is no limit in the equipment and all things. In that respect, I would recommend the guidelines that have been produced by the International Council of Ophthalmology that can be found on the ICO website. I mean, you just Google ICO ophthalmology and you'll find guidelines, for example, for diabetic retinopathy or for glaucoma that are very well designed because they are kind of international. It's the state of the art, and there are different level of resources available. And you can also find on this website, the ICO is producing a lot of resources for residency programs.
Yes, that's completely true. So if somebody that is seeing right now want to contact you to any other question, where they can find you?
They can find me just by sending me an email. It's very easy because it's my name. It's serge.resnikoff@gmail.com. So it's very easy, and there are many people I think you could help if needed.
Yes, thank you. We're going to put in the down part of this video the contact of the doctor, and we're going to put the links of this all information that you just give us right now.
That would be terrific. Thank you so much. Thank you.
Serge.
It's been a pleasure. Thank you.
The pleasure will be on mine.
Thank you.